Next, we're going to demonstrate the application of Meplex foam dressing with SafeTech technology using either the Meplex foam or the Meplex light foam. Either one could be used. It's your clinical judgment based on the patient and what's best for them. And the goal of this application is to apply to the nasal cannula area to prevent pressure injuries from the tube. So next what we're going to do is make our cuts, and you can use your guide. We have a picture for the nasal cannula that you can just follow, and you can draw it onto your foam, your cuts, or if you know it by hand or by eyesight, you can just cut it out that way. This one's pretty easy to do. So I basically made the lines, and then you're going to cut the dressing. Probably could get a couple different applications out of one foam dressing and put the rest back in the package if you desire. Then you're going to remove the backing sheets, but before you do that, I would make sure to date the dressing. Always important to date the dressing so you know when to change it. It does have a 7-day wear time. And then you're going to put it right underneath there, and the goal is to have that tube laying right on the foam dressing without covering the nostrils, obviously. Okay, so it's kind of like a mustache underneath the patient. The tube should be sitting right on the foam so it's not rubbing against their skin, but laying right on top of the dressing. Some other important best practices with the dressings is to make sure the skin is dry and free of any kind of creams. The SafeTech is hydrophobic, so it doesn't stick to moisture. So if the patient's sweating like they do in the ICUs, just try to pat their skin dry before you apply the Meplex dressing. It is okay. I know sometimes we get asked if you can use skin preps on the dressing. If the patient's really sweating, you just can't get a good stick. We don't recommend them to protect the skin because the SafeTech is very gentle and you don't need the skin preps. But if it's something you need to help keep the dressing down, that would be appropriate. So again, this would be the application for the NG tube or the nasal cannula.